Oh, shoot. Ah, okay, I guess I'm live on Instagram as well as Facebook. I'm having some issues with Instagram. I'm just going to restart that. Delete the video. Just give me 1 second. Bear with me and I will be right ready. Okay, so let's. Okay. Okay, I think I'm live. Okay, hello everyone. Welcome to another Wellness Wednesday. I'm your host, Dr. Manjiri Nadkarni. I'm an Ayurvedic MD, registered holistic nutritionist. Today we are going to talk about irritable bowel syndrome. So we are in April, which is actually the IBS Awareness Month, and this is something that I see a lot in my clients. So this is one of the most common health conditions that I see in my practice because I deal a lot with chronic digestive issues. So, if you have any questions about IBS, if you're struggling with it, please let me know. And if you have questions, please let me know about that as well. If you are watching this live, please say a quick hi. If you are watching this as a replay, you can put a hashtag replay, post any questions at any point of time. I'm going to say a quick hi to Chetna. I'm going to say a quick hi to Ravi as well as Marcy. They've all joined me live. So let's get started. Let's talk about IBS, what exactly it is, what, is the condition and what about the diagnosis. So let's get started. Okay. So IBS, exactly what is IBS? We talk about IBS being extremely common. People about 10 to 20% people in North America struggle with IBS, but one of the most important things is that it's even more common with my practice. I see at least 80% of my clients struggling with IBS, right? So it's something that's extremely common and it is a functional disorder. So, what is a functional disorder is that there is an issue with the function of your gut, especially your larger intestine, right? Um, and it is a functional disorder, so sometimes there might not be any structural issues or structural changes, or even on a CT scan or something you might not notice anything out of the norm, right? It is a structural disorder. It is a functional disorder rather than the structural one. Hi, Bijal. Hi, Amy. Nice to see you. We're talking about IBS or irritable bowel syndrome, right? So it involves issues with any kind of motility, right? So the movement of the digested food through your intestines is what um, uh, has is kind of malfunctioning or has problems. There is also pain, right? And there is also sensitivity. So there is no structural abnormality as such, but people experience pain in their intestines, right? Especially in the large intestine, there's a lot of abdominal cramping, there is a lot of abdominal discomfort, and there could be either diarrhea or constipation, but cramping is one of the most common features when it comes to IBS or irritable bowel syndrome. So people, when they go for testing, like if you go for an ultrasound or if you go for an MRI CT scan, you might not find anything wrong with your gut, right? So everything's fine, but yet it's creating a lot of cramping. Like suddenly you have a lot of cramps, suddenly you have diarrhea, suddenly you have constipation. So let's talk about what are some causes of this IBS, right? So one of the main causes, or one of the most common ones that I see in my clients, is there is altered gastrointestinal microbiome. When we talk about gut flora, when we talk about the importance of probiotics, the one thing that everybody needs to know is we all have bacteria in our gut. Some are good, some are not good for us, right? So if you have more of this bad bacteria, it's a condition called gut dysbiosis, and that can eventually lead to this IBS as well. There could be different infections, if you have issues with excess fungus or candida, that can also trigger your IBS or create issues with IBS. So that is something that's really important to know. One of the other things is there is altered endocrine metabolism. So serotonin or 5-HT, right? It is one of the most important molecules in our body. It's also called as the happiness molecule or the calming molecule. And it is released from the enterochrome. muffin cells, in your intestinal lining, right? So if you have issues with any of your gut cells, you're not going to secrete this, and that can also create issues with your digestion. um, there are food sensitivities. When we talk about IBS, my talk is going to be incomplete if I don't mention uh, certain foods like gluten or even dairy, right? So when I see my clients who have IBS, who are really struggling with digestive issues, who have bloating, constipation, diarrhea, urgency, sometimes, they're not comfortable going out or leading a normal life because they just can't, they have so much pain, and they could have incidences if they go out and they're not sure of the environment, or if there's an accessibility to a toilet or not. And while um, people who don't have the condition can't perceive what people who have IBS go through, it can be really challenging to someone's life as well, or social circumstances, like you can't socially engage with people if you're not sure what's going to happen with your gut. So that can also create a lot of anxiety here. So, one thing to understand is one of the most common ones that I see in my practice, one of the most common foods that often interferes with this IBS or which triggers IBS is gluten, right? So, gluten is something that is made up of, like, that has wheat, or that is a protein present in wheat, rye, spelt, or barley, right? So these are mainly the four gluten grains. There could be gluten in other foods as well, and this gluten can trigger your IBS, right? Milk proteins, lactose can cause issues like bloating or diarrhea and also trigger IBS, but also milk proteins, whey shakes. If you're constantly having whey protein, if you're constantly having lots of cheeses, which are caseinated, you could also suffer from IBS because of those cheeses, right? Sometimes there are changes that occur because of different hormonal levels as well. So, whether it's cortisol or the waning female hormones, they can all eventually trigger IBS or irritable bowel syndrome. And that is why it is extremely important to understand. Also, because of certain bacteria and viruses or any kind of antigens, related with allergies, your intestinal permeability can increase, right? And that can create an activation of the immune response in your gut, and you get a lot of chronic diarrhea or constipation because of it, right? Sometimes even bile acid malabsorption. So we're all secreting bile, which is one of the most important factors for fat digestion and metabolism. So if there is malabsorption of this bile acid, that can create issues as well. And a recent survey in UK saw that bile acid diarrhea is nearly 1 in 4 of the IBS patients, right? So these are some things we were talking about, the causes of IBS. So IBS can be multifactorial. It's not always that you're just going to have issues with food. You could have other conditions similarly going on with your hormones, or your stress is too high. Stress is again a common cause of IBS as well. And that is why the moment you get stressed, you're going to have worse pain, you're going to have worse diarrhea, right? So this is something you need to understand. I'm going to say a quick hi to Mukta. There's Dr. Aman Chabra. There's Jessica as well. There's Amy. So we are talking about IBS, irritable bowel syndrome. If you have any questions for me, please post it in the comments, and I'll be more than happy to answer your questions. And if you are watching this live again, just say a quick hi. I would love to know who's live at this time, right? So these are some factors we're talking about IBS or irritable bowel syndrome. So what are the symptoms, right? So one of the there are four main things. There is abdominal pain. There's always going to be pain. Usually it can be in the lower abdomen, and there can be sharp stabbing pain. There can be shooting pain. There can be painful spasms, almost like your intestine kind of twists. That's how uncomfortable you feel. And this pain occurs at least 1 day per week, or it can be on a consistent basis. Sometimes people have pain every single day, and they try to get all the testing done. They go to their doctors and they don't really find anything wrong with them, right? And another misconception is that the pain always has to be in the lower abdomen, but you could also have upper abdominal pain associated with bloating. You could have mid abdominal pain, and the lower abdominal pain usually is eased by a bowel movement. So these are some of the signs of IBS. I'm just gonna look at my notes. There is bloating again, So when you have a lot of dysbiosis, when you have more of the bad bacteria, then good. There can be a lot of odor, there could be a lot of bloating, gasiness. There could also be some farting, right? That people are not comfortable with. Diarrhea, constipation are again some of the most common signs, and IBS is then categorized into D with diarrhea, IBSD, or constipation with IBSC, or there could also be like mixed diarrhea and as well as constipation. So let's talk about Ayurvedic perspective. Whenever we say things about IBS or whenever we're doing this Wednesday sessions, I really love to talk about certain things and correlate them with Ayurveda, right? Hi, Chetna. Hi, Susan. Thank you so much for your feedback. So, one of the most common things when we talk about, IBS is that when we look at the pelvic region is under the domain of this Vata dosh, right? We talk about wind energy, we talk about Vata dosh in Ayurveda. So, this Vata dosh is made up of space and air as elements, and it is the one thing that mainly governs all the activity in your pelvic region, right? And that specific kind of vata dosh is known as apan vayu, which is responsible for downward movement of your feces as well as urine. So if you are having a lot of issues related to either constipation, then this vata is out of balance, right? Or it's either malfunctioning or over functioning. So if you have diarrhea, there's a lot of intestinal movements and cramping, and that could be aggravation of vata dosh. And sometimes if you're constipated, it could also be due to obstruction in the channel of this vata dosh, right? So Susan is asking me what is the best things to do for constipation. That's a really, really good question, Susan. Thank you for asking that. um, Depending on what's going on, see, with constipation again, if you're having things known as rabbit poop, if you see small pellets, if you have a really small bowel movement where you are overall constipated and you have to strain a lot, if there's a lot of dryness in the gut, it can be seen as rabbit poop or tiny pellets, and that's when you know that you're not having enough fluid intake, which is water. You're also not having enough fat content in your diet, which is necessary for lubrication in your gut as well, right? So three main things that I talk about whenever we talk about constipation, and these are extremely basic. One is fiber, fat, and fluid, right? So fiber is, fresh fruits, vegetables, rather than having processed foods. An example is sprouted whole grain, even wheat, if you're not allergic to gluten, is going to be better fiber content wise than looking at white breads, right? So all your vegetables, leafy green vegetables are fantastic sources of fiber. Always have them cooked because they're easier on the digestion. So fiber, having adequate amounts of fiber is extremely essential when we talk about constipation. Fluids, if you're not drinking enough water, you will tend to be constipated, right? So you have to ensure that you're drinking ample amounts of water. Now, how do you test whether the water you're drinking is enough or not? You can take your nail and just draw a white line, like just scratch your hand a little bit. Today I'm a bit dehydrated, so you can see this white line. So that's one simple way. Or you can pinch your skin, and if the pinch stays, then you know you're dehydrated, right? But if you feel parched, if your skin is dry, chances are you are dehydrated. And having good amount of digestible fat is extremely important when it comes to constipation. Now, avocados are one of the most loved foods today, right? But the one thing to realize is also avocados can be heavier to digest for certain people. So make sure that whatever fat you're having is easier to digest. You can have olive oil, coconut oil, avocado oil. You can have avocados as well. You can have ghee or clarified butter. So there are different kinds of fats that you can add in your diet, which is going to help with digestion. Now, when we talk about this IBS or when we talk about irritable bowel syndrome, right? One thing to understand is the first line of treatment anytime we talk about Ayurveda is to get rid of foods that are not working well for you or that are triggering your IBS, right? So when we talk about foods, if you are reacting to gluten or if you are reacting to dairy, until and unless you take these things out of your diet, your digestive tract is not going to start healing because it's constantly going to be irritated. So, the one thing for irritable bowel syndrome is to take the irritants out. What exactly is irritating your gut? What exactly is irritating your bowels? If it's foods like gluten, if it's foods like dairy products, you have to take these out. If it's stress, if you are somebody who's a high stress person, and whenever your life stress increases, you have a tendency towards IBS, right? Then you have to really focus on eliminating the life stress that you have. If you're having a lot of bloating or gassiness and you have infections like candida, you're constantly getting yeast infections, bladder infections, skin rashes, skin patches, then you know that okay, your yeast count is a lot more. So for that reason, what you have to do is you have to correct this dysbiosis. You have to make sure that you're using foods or herbs that are killing the bad bacteria, and then you're adding the probiotics or the good bacteria in, right? Just supplementing with a probiotic may or may not give you the results that you desire for your digestion, right? So, the number one thing, because I was going to talk about the holistic measures to relieve IBS, the first thing you have to do is take these foods out. And gluten and dairy are two of the most common ones I'm talking about. But there can be anything and everything that could irritate your gut, right? So, in my clinic, I offer muscle testing for food sensitivities and allergies. And I have a kit with about 72 foods that I can test you for. So sometimes it's milk, sometimes it's cheese, sometimes it's goat milk as well. Sometimes it could be vegetables like pineapple or even kiwi, right? So there are going to be so many different vegetables or foods that you eat which may trigger your gut, right? Some people have a lot of fiber, and that could also be one of the most common causes of trigger IBS. So that's a really good question, Raj Gopal. Apart from processed foods, how do I know food is not working for me? So what you have to do is that you have to keep a food journal, right? This is the one thing that I tell most people is always keep a food journal, right? And that will show you that if a specific food that you eat is interacting with your body in a not so great way. So you can keep a food symptom journal where, okay, I eat this for breakfast and I watch for any symptoms. I eat this for lunch and I start getting stomach ache. Okay, so what did I have for lunch? Maybe I had a piece of bread and that created issues with me. Right. So these are a few things you have to keep in mind when it comes to your food. And if you have a lot of inflammation, if you're trying to lose weight and nothing changes, if you are having constant diarrhea, constant constipation, if your skin is really lackluster, if you have hair falling out, chances are your food is not working for you, right? And often I see is people start supplementing with either vitamins or minerals or herbs, but they forget this primary thing called food. So the food corrections are one of the most important things, not just for IBS, but for any other condition that you might have, right? Now stress again is one of the most important things when it comes to IBS. So one simple strategy that I tell all my clients is you have to sit and eat and sit in a calm place. You have to make sure you're not multitasking when you're eating. You don't have to answer your emails at the time you're eating. You have to solely dedicate time to eat. And if you are somebody who is constantly agitated or reactive or constantly like hyperactivated, one of the simplest ways to bring yourself like down, calm yourself, ground yourself is alternate nostril breathing. So literally, taking like using alternate nostril breathing. So you breathe in through one nostril, breathe out through the other, right? So you can breathe in through your right, hold, breathe out, breathe in through the left, hold, breathe out. So one in, one out, one in, one out constitutes one cycle. you can do at least 5 cycles before you have each meal. That is going to really balance your left brain, right brain activity and really ground you, right? And this is also how you are going to calm yourself down, and it's going to help your digestion, because you're not in that fight flight mode, you're not in the mode where you're reactive or you're triggered. Right now you can enjoy your food, the food will break down, you're going to secrete the enzymes, and that is really going to support your digestion, right? So that's the one thing you can do for IBS. Now, one of the things that I see a lot in my clients, and this is an observation that I've had in a lot of my clients, is they know that they need to add fiber, but what they end up having is a lot of wheat bran, right? So they'll have wheat bran muffins or they'll have bran buds, but bran could be a scratchy fiber for a lot of people. It's not as soft. So in your gut, if you're having irritation or if you are reacting to gluten, your reactions are going to be worsened because of this, right? So if you are having wheat bran, taking it out, either adding leafy green vegetables is a good option. The other option is psyllium husk, right? Psyllium husk is a nice fiber. You can get the powdered psyllium husk as well, which is not going to react. It's easier to digest than the other one, and it is an insoluble fiber. So when you drink it, it's going to expand in your gut, but it also takes excess heat out of your body for those who struggle with acidity or excess of the heat. Psyllium husk is one of my favorite remedies for constipation related to IBS as well, and it does not irritate your bowels. It's a pretty safe and smooth fiber to have, right? Any other questions? Okay, questions so far. Okay, so one of the things that I offer here is for resetting your gut. I offer a program called Digestive Rebalance Program, and it's based on simple principles of Ayurveda, where I also integrate it with the modern holistic nutrition for allergy testing. So what I do is I test you via your muscles for any food sensitivities, allergies that you have, and then we start a gut healing protocol for you, right? And that's based on your unique, we talk about dosha types, but we also talk about dosha imbalances, right? So understanding both is extremely important when it comes to, again, the Ayurvedic perspective. Bringing, like, realigning this vat dosh is extremely important, right? So if it is overactive, if it is aggravated, it's aggravated in your entire body, not just your gut, most times. So you have to ensure that you're first bringing this vata into balance, and that supports the healing of your gut. Now, a few common things that people use for gut healing are sauerkraut or kombucha or kefir. So these are probiotic rich foods. Make sure you're not having any reactions to histamine or histamine intolerance. If you have those associated conditions, then these might not work for you. From an Ayurvedic perspective, you have to make sure you don't have a lot of pitta aggravation before you start adding the sour foods back in your diet, right? Bone broths are pretty popular for gut healing, and I've seen these to be generally very effective, right? When we talk about bone broth, for people that eat meat, you just have to get bones. You have to ensure that you're cooking those bones with 1 teaspoon of apple cider vinegar, lots of vegetable scraps, and cooking it for longer periods of time. And what that leads to is a nice nutrient rich broth that can really support your digestion. Again, if you have issues with histamine intolerance, that is not the way to go. But for most people, this bone broth can really support the healing of your gut as well, right? Yeah, so Rajgopal, see, food is one thing. There are other factors as well. That is a really good question. That even if I eat the same kind of diet, sometimes you get IBS issues because there is a lot more going on. It's not just the food that's triggering. It could be stress related, or there could be different thresholds of your body that can handle it, right? Sometimes you can handle maybe 10 grams of a certain thing and the 20 grams would throw you off. So this is just an idea, but we can discuss more. I know we're going to have a call soon, so we can discuss more about your condition and what's exactly going on with you, right? So this is a few, like, these are my thoughts on irritable bowel syndrome or IBS. Really, try to spend time with yourself, try to get in touch with your body, try to see what kind of symptoms you're having, right? Try to see if there's bloating, how bad it is, or if you have diarrhea or constipation, how bad it is, right? And how often it is. So once you know that, then you can look at gut healing, right? And see, when it comes to gut healing, again, on the internet you'll find 50,000 different diets. You'll find SCD diet. I'm not going to get into the details of different diet, but there's a specific carbohydrate diet. There are different autoimmune protocols as well. So there are different diets on the internet, but they might not be specific for you. So the first thing you have to do is, follow a diet that's really suitable to your body, right? And also suitable to healing your gut. So that's extremely important. So I hope this was useful. I hope everybody learned some useful information. If you have any more questions about IBS, irritable bowel syndrome, or digestion, just let me know and I'll be more than happy to help you out. For everybody here, I'm also hosting a 7-day spring cleanse, which is called Reset and Rejuvenate with Ayurveda. So this is a 7-day reset where you get recipes to reset your body, mind, and also your senses. And we are going to incorporate a lot of Ayurvedic practices as well. And you get delicious recipes. You're not going to be fasting. You're not going to be starving. You're not going to be on a juice cleanse. So I'm not, or a khichdi mono diet, which is not Ayurvedic. So this is planned in a way that we're going to focus on getting rid of this excess kapha dosha in your body, as well as healing your digestion and making sure that you're strengthening your system as well. So that's my goal for the spring reset. Thank you so much for watching this live. I'm going to say a quick hi to Jasmine. I'm going to say a quick hi to Ria. There's Ayurvedic, Yunalom, and there's Health Onwards as well. I'm going to say a quick hi to everyone. And I'm almost finishing this video. So check it out, go over the video. If you have questions, please get back in touch with me and I'll be more than happy to answer. Thank you so much for watching this live. I will see you soon. Have a fantastic rest of your day. Bye for now.